learners, today we are going to discuss about family therapy and counseling in substance use disorders. Let us see what is family therapy. Family therapy is a structured form of psychotherapy that seeks to reduce distress and conflict by improving the systems of interactions between family members. Family therapy is underpinned by the belief that the family is a unique social system with its own structure and patterns of communication. These patterns are determined by various factors such as parents' beliefs and values and personalities of all family members and the effect of the extended family. As a result of these variables, each family develops its own unique personality which is powerful and affects all of its members. It is an ideal counseling method for helping family members adjust to an immediate family member struggling with an addiction, medical issues, or mental health diagnosis. There is a more focus on the interrelational aspect between various members of within a family. Therefore, there is a little focus on the individual part in order to facilitate the treatment. Furthermore, family therapists tend to be more interested in the maintenance and solving of problem rather than in trying to identify a single cause. Depending on the conflicts at issues and progress of therapy to date, a therapist may focus on analyzing specific previous instances of conflict as by reviewing a past incident and suggesting alternate ways family members might have responded to one another during it, or instead proceed directly to addressing the sources of conflict at a more abstract level as by pointing out patterns of interaction that the family might have not noticed. Some families may perceive cause-effect analysis as attempt to allocate blame to one another individual, with the effect that for many families a focus on causation is of little or no clinical utility. It is important to note that a circular way of problem evaluation is used, especially in systemic therapies, as opposed to a linear route. Using these methods, families can be helped by finding patterns of behavior, what the causes are, and what can be done to better their situation. In India, families form an important part of the social fabric and support system, and as a result, they are integral in being part of the treatment and therapeutic process, especially in substance use disorders. The impact of substance use disorders is not restricted to the individual alone, but to family members or caregivers also. This type of stigma is known as courtesy stigma. Families are generally unaware of and lack information about impacts of substance use disorders and how to deal with them, and in turn may end up maintaining or perpetuating the substance related disorders too among other family members. Family counseling or therapy offers families a way to develop or maintain a healthy functional family. Patients and family with more difficult and intractable problems such as poor prognosis, schizophrenia, conduct and personality disorders, chronic neurotic conditions require family interventions and therapy. Let us see the goals of family therapy in substance use disorders. Family therapy intends to incorporate changes in behavioral and emotional problems of children and adolescents, better improvement at the academic front, and better functioning of the family. Dysfunctional families hurt the most and may cause damage to the teen in an irreparable sense. The main aim of the counseling is to resolve the dissonance and other issues within the family and thereby improving the psychosocial functioning of the family. Therapists intend to reduce the defensiveness of the teen and parents and help them in perceiving their behaviors in a different sense. This helps family members to connect with each other and more efficiently. Usual goal of family therapy are improving the communication, solving family problems, understanding and handling special family situations, and creating a better functioning home environment. However, in substance use disorders, it also involves enhance the coping ability of family members and reduce the negative consequences of alcohol and drug abuse on concerned relatives. Eliminate the family factors that constitute barriers to treatment. Use family support to engage and retain the drug or alcohol user in therapy. Change the characteristics of the family environment that contribute to relapse. Exploring the interactional dynamics of the family and its relationship to substance use. Mobilizing the family's internal strength and functional resources. Restructuring the maladaptive interactional family styles, including improving communication, strengthening the family's problem solving behavior. Different schools of therapies and their usage in familial systems. Psychodynamic approach. It is based on the theory of psychoanalysis. In this therapy, the therapist tries to understand the dynamics employed by different members of the family and the interrelationship of these members. These family ego defenses are interpreted to the members, and the goal of the therapy is to develop emotional insight and working through of new defense patterns or mechanisms. Family transferences may become evident and may need interpretation. Therapy may be employed in persons who are psychologically sophisticated and able to understand dynamics and interpretations. Sustained and high motivation is necessary for such a therapy. This method is found useful in couples with marital discord from upper middle class background. Time required is a major constraint for psychodynamic family therapy. Let us see the behavioral approach. The basic assumptions of behavioral methods is that maladaptive behaviors, not underlying causes, should be the targets of change. Therapist is given the central position and may be considered as an expert teacher, collaborator, and coach. Psychoeducation and skills training in communication and problem solving are found very useful among families which do not have very serious dysfunction. Techniques such as modeling or role plays are useful in improving communication styles and to teach parenting skills with disturbed children. Obviously, motivation for therapy is a major requisite, and hence techniques such as contracting homework assignments are used with the family. Another approach is a structural approach. This form of therapy assumes that symptoms of the illness, as in the case of substance use disorders, are understood in terms of family interaction patterns. Our families are available with their manifold subsystems of parents, children, grandparents, and the structure is easily discerned and changed. The family organization sometimes poses challenges and becomes an obstacle in the direction of change. Therefore, family organization must change before symptom reduction. There is an emphasis on the whole family and its subunits. Techniques like unbalancing, boundary making are quite useful, as the common problem involves adolescents who are wielding power and poor marital adjustment between parents. Strategic techniques. Techniques like brief intervention and reframing, positive connotation, paradoxical symptom prescription have been used effectively in the treatment of substance use disorders. Such short-term treatment modalities are highly effective and innovative. Brief techniques can be very powerful, used with families having a history of substance use. Especially, these families are difficult and highly resistant to change. Familiarity and competence with these techniques is a must, and therapy is usually brief and quickly terminated. Now, let us see the phases of family counseling. Family counseling is conducted in following phases. Initial phase of counseling or therapy. A. Engagement or referral intake. In this phase, patients and their families are usually referred to a therapist for some family problems which is causing distress among associated family members. All the relevant information is collected about the index client and family members at the time of the intake. At this session, the therapist builds a working alliance and tries to connect with family members. The aim of the intake session is to briefly understand the family's perception of their problem, their motivation, and need to undergo family intervention, and the therapist assessment of the suitability for family therapy. The do's and don'ts and general rules for the intervention are laid down to the family at the outset of the process of the intervention. An unconditional support is provided to the family to stimulate some hope for the betterment and continuing the counseling. B. Family assessment. In this phase, counselor tries to assess weak and strong points about behavioral patterns of the family members. The assessment of different aspects of family functioning and interactions typically takes about 3 to 5 sessions with the whole family. Each session lasts approximately 45 minutes. Various tools and scales are used by the counselors. C. Formal contract. A brief understanding of the family homeostasis is presented to the family. The therapist presents the treatment plan to the family and negotiate with the members the plan and action they would like to take up at the present time. The time frame and modality of therapy is put into force. The frequency and intensity of sessions are determined by the degree of distress felt by the family and the geographical distance from the treatment center. Creation of motivation to change. As we know, motivation is the center of the change to treatment. So, if a patient does not want to change their behavior, it means the motivation is low. And motivation does not only depend upon the patient or client, it is basically developed during the interaction with the counselors. So, let us see how the motivation can be created for change. Motivation for changing old behavioral patterns can be done by using some positive statements. For example, therapist may say, quitting alcohol is not easy and most people during this journey fall back to their prior habits. But I appreciate that you have decided to seek help for quitting it. Another way, like this shows that you are really determined to quit it. So, therapist's job is to develop some hope in both parents and the client. Conductance of the primary intervention. In this phase, counseling techniques are used to intervene and break the negative cycle of problematic behaviors of the client and family members. The behavior modification is the main objective of these interventions. For example, multidimensional family therapy can be used. The last stage is termination. It is the last phase of the family therapy that is finished in a couple of sessions. It includes briefing about the whole process. Questions are asked about any observed changes in behavioral pattern of the client and family members. The family and the therapist review together the goal which were achieved, and the therapist reminds the family the new pattern or changes which have emerged. The need to continue these new patterns is emphasized. Family members are reminded that it is easy to fall back to the old patterns of functioning which had produced the unstable equilibrium necessitating consultation. Sometimes booster sessions are also advised, especially for outstation families who cannot come regularly for follow ups. The booster sessions will review the progress and negotiate further changes with the family over a couple of sessions. The follow up periods after therapy is terminated and is crucial for working through process and ensures that the client therapist bond is not severed too quickly. It must also be noted that the chain of communication shouldn't be broken down at any cost, and the family must be told that whenever they need, they can contact the counselor for holding further sessions as per their need. Let us see some handpicked family based modalities in clinical settings. Based on the specific problems faced by the client and associated family members, the therapist may use different types of family therapies, which may include behavioral couples therapy (BCT) intended for married or cohabiting couples where one person suffers from a substance use disorders. This therapy promotes and rewards abstinence through a daily recovery contact. This involves the person with the substance use disorder experiencing his intent not to drink or use drugs and the partner supporting their efforts to stay abstinent. It can help improve communication, reduce stress, and maintain abstinence. Another technique is family behavior therapy (FBT). This modality has been successful with both adults and adolescents with substance use disorders. It's a sort of a pick and choose your own therapy based on a menu of evidence based treatment options that aim to impart skills to help clients and family members. This therapy focuses on how the behavior of the person with the substance use disorder affect the family as a whole and to change those problem behaviors with the involvement of the entire family. Brief strategic family therapy (BSFT). This form of modality deals with adolescents with substance use disorders. It is based on interventions that focus on family interactions. The core assumption is that the adolescent substance abuse stems from unhealthy family dynamics. Let us see the functional family therapy. This form of therapy is used to help families with adolescents with substance use disorders. FFT focuses on improving family interactions since the underlying belief is that unhealthy family dynamics lead to problem behaviors. Thus, strategies include effective communication techniques, problem solving, conflict resolution, parenting skills, behavioral contract, etc. Another technique is community reinforcement and family training (CRAFT). CRAFT takes a structured approach to teaching families dealing with substance use disorders positive reinforcement strategies to encourage the loved one with the substance use disorder to change their problem behaviors. Multisystemic therapy. This model intends to help adolescents with problem behaviors and substance use disorders, including violent behaviors and criminal records. MST utilizes goal-oriented techniques and family strengthening strategies to encourage adolescents to change their problem behaviors. Multidimensional family therapy. Now let us see it in detail because this is highly used and very effective therapy with adolescents using substance use disorder. MDFT is a family-centered multidimensional approach used for treating psychological ailments in adolescents like substance use disorders, conduct disorder, emotional incompetencies, hostility, anger, depression, and anxiety, along with familial problems. It considers substance use disorder as a deviation from the healthy and adaptive functioning of an individual due to an impairment in the familial functioning. The likelihood of deviation from the normal path or substance use depends on four dimensions. First one is substance user, that is at adolescent. Second one is parents. Third one is familial interaction or communication. And fourth one is extra familial relation. An improved functioning in these domains result in the decreased risk for substance use and less problematic behaviors of the child or adolescent. Let us see the assumptions of multidimensional family therapy. Problems of adolescents are multidimensional in nature, like physical growth, finding a purpose of life, identity formation, state of autonomy, need of belonging, formation of emotional and sexual relationship, etc. Motivation is malleable and can be altered. Motivation refers to biopsychosocial drive for fulfilling the needs or desires of a human being. It can be intrinsic, that is internal, or extrinsic, that is external in nature, and can be altered by the help of external events or stimuli. Better and healthy familial functioning reduces depression, anxiety, and distress level and produces long-lasting changes in the adolescents. So, what are the anticipated outcomes of multidimensional family therapy? One, like increased family stability. MDFT helps in resolving latent issues within the families and thereby strengthen parent-child relationship. Mitigation of substance use, second one. So, by using various techniques like drug testing, urine testing, blood testing, adolescent focused sessions, parental counseling, etc., multidimensional family therapy intends to decrease the likelihood of substance use in adolescents. Third, increased academic performance. Betterment of the academic performance in adolescents by imparting them healthy skills like time management, pro-social behaviors, life skills, etc. Fourth, reduced psychological symptoms. Reduction of the symptoms like covert anger, that is called inner aggression, stress, anxiety, etc., by learning to see things from different perspectives. Let us see the special socio-cultural issues in therapy specific to our country. Most Indian families are functionally joint families, though they may have a nuclear family structure. Also, unlike the Western world, more than two generations readily come for therapy. Hence, it becomes necessary to deal with 2 or 3 generations in therapy and also with transgenerational issues. Our families also foster dependency and interdependency rather than autonomy. In Western culture, autonomy is more focused. This issue must also be kept in mind when dealing with parent-child issues. In India, we have a varied cultural and religious diversity depending on the region from which the family comes. The therapist has to be familiar with the regional customs, practices, beliefs, and rituals. The family therapist has to also be aware of being too directive in therapy, as our families may give the mantle of omnipotence to the therapist, and it may be more difficult for therapists to adopt at one down or non-directive approach. So, directive approach is helpful in our country. As we have seen, family therapy is highly effective in substance use disorder, but there are several constraints in delivering this therapy. For example, due to economic backwardness, the poorer families usually drop out of therapy due to losing mandates, and they have other more pressing priorities. The lack of tertiary social support and welfare of social security makes it less possible to network with other systems. There is no social security schemes in our country, those who are seeking for any type of treatment. There is also a paucity of trained family counselors and therapists to cater to our large population. Also, distances seem rather daunting, and modes of transport and communication are poor for families to readily seek out a therapist. To conclude, the impact of substance use disorders is not restricted to the individual alone, but to family members also. Family therapy seeks to reduce distress and conflict by improving the systems of interaction among family members due to substance use disorders and other psychological ailments. It is an ideal counseling method for helping family members adjust to an immediate family member struggling with an addiction, medical issues, or mental health diagnosis. Thank you for patiently listening. So, I thank you all and hope you can understand this family therapy and use in your practice. Thank you.